Yeah, thank you. Let's jump right into the session, and I want people to hear Valerie's amazing story. I'll quickly run through the introduction, and then we can begin. Hi, I'm Meera Sahai, the Chief Operating Officer of D-Life Healthcare Private Limited, a very proud D-Life certified metabolic health coach, and the lead host of the third Metabolic Health Conference, organized from India by Shashikant Iyengar and Anup Singh. D-Life is India's first and the only award-winning low-carb platform, founded in 2014 by Anup Singh, a silver medalist from India's Ivy League institution, IIT Roorkee. Anup is also the recipient of the Icons of India Award, and he pioneered the low carb movement in India with his path breaking protocol of 100-gram carbs per day max, which is now widely used. And this was back in 2012, that made not only LCHF but also type 2 diabetes remission possible for even Indian vegetarians. So, Valerie, let me just introduce you, and probably we'll talk more about, the conditions that you had. Valerie Smith is a metabolic health coach. She used a ketogenic carnivore diet to put lifelong schizophrenia into remission in 2018. Along with it, healing many other illnesses. You will be surprised, shocked, and very, very delighted, to know what Valerie has achieved, in by going carnivore. So we'll talk about this and more. She uses those same dietary strategies with her clients to guide them into health and freedom from mental and physical illnesses. She focuses on a low carbohydrate lifestyle combined with fasting and strength training as the trifecta of vibrant health. Valerie is featured in the Journal of Metabolic Health case series titled Animal Based Ketogenic Diet Puts Her Severe Anorexia into Multi-Year Remission. And just before we start asking Valerie her story and the questions, here's a list of illnesses and issues that Valerie had. Schizophrenia, extreme anorexia, anxiety, panic attacks, clinical depression, hypothyroidism, osteoporosis, bone pain, fractures, IBS, GERD, severe vaginal atrophy, bladder pain, spasm, overactive bladder, oxalate toxicity, adrenal fatigue, hormonal deficiencies, tinnitus, and more. Valerie, wow, what a story you have. Would you want to add something in case I missed it? I mean, I was shocked to see the list of things that, you when you gave it to me, it was a shocker for me. So tell us, Valerie, first of all, welcome. And you have an amazing, amazing story. You recovered. God bless you and all the best. But please take us to the time, maybe in January 2018, when you had all those conditions that you were battling with. What was life back then with severe depression and all of these conditions?
Thank you. Yeah, it's amazing to be here. I'm just honored to be able to speak to you and speak to everyone watching the conference. Yes, the list of what has healed is long. 6 mental illnesses and about 15 or 20 physical illnesses, depending on how detailed you want to get with symptoms. I've been ill as far back as I can remember. I don't have any memories of being physically or mentally ill. It goes all the way back to when I was 3 years old and the anxiety and the depression started. So I lived a lifetime of just not being well. And in 2018, that would have made me 48. And I was at the end again. I mean, I'd been at the end, I'd been at rock bottom many, many times over the course of all these decades. And I somehow would pick myself up and try again, find a new doctor, find a new medication, find a new psychiatrist, find a new inpatient facility. And at that point, at 48 in 2018, my life was just, it was unlivable. It was just filled with pain. Mentally, I was plagued 24 hours a day with schizophrenia. I had these screaming, dark, violent voices that screamed for me to harm others and to harm myself. And in order for me to not harm others, I turned that punishment, that harm on myself. And that was where the cutting and the hair pulling began. I was punishing myself by cutting my arms and legs to keep myself from following what the voices wanted me to do. And of course, part of that was the extreme anorexia. That was part of the self-punishment. That was the drive to starve, the body dysmorphia I experienced when I looked in the mirror. I saw someone very obese. There's just a separate mental illness component of the brain that pulls up all of these anorexia symptoms. And I had OCD and, of course, anxiety and depression. You don't go through that kind of mental anguish and not be filled with anxiety and panic attacks and just an overarching sense of doom and depression all the time. I was once again at that year 75 pounds, and I'm 5'9". I was very skeletal, to say the least, and I was in jeopardy of losing my life. My heart had shrunk half its size because I had no musculature left on my body, in my body, and mentally I was just beyond what I thought was repair. And physically, that was the end of 4 decades of malnutrition, of starvation. And physically, I was in ruins. I had been diagnosed with osteoporosis at 16. And by the time I was 48, I had such chronic bone pain all of the time. And I was then experiencing fractures. I had 5 fractures within 5 years. And I wasn't doing anything traumatic. It was just everyday life. And I would fracture a bone. Physically, I had hypothyroid and I had all kinds of gastric, GI distress issues, IBS, all kinds of female physical pain that I now know were high oxalate vegetables and combined with no fat and no animal protein many decades. That's what on these pelvic female disorders that doctors said were incurable. I was just physically and mentally just gone. And I knew I wasn't going to last another year. I began desperately trying to search for something different to try, or I was going to give up. There wasn't anything left to try.
Now, Valerie, I'm very curious to know, before you came onto the carnivore diet, what was your typical diet like?
It was the lowest calorie that I could possibly get away with. Every decade I eliminated something. In my teen years, the first things to go were protein and fat. So that was the huge macronutrients that I eliminated first, that I did the longest without. Not an egg, not a piece of chicken, nothing. And nothing with fat, no oil, no butter, nothing. So for many decades, I subsisted on fruits and vegetables and carbs. And as I progressively got worse, and in the times when I was in active starvation and not under treatment that pushed a plant-based carb diet with a lot of convenience foods to prove that I wasn't anorexic anymore, canola oil and inflammatory, processed carbs, when it was on my own, it was spinach and celery and nothing else. And on a day, maybe I would allow myself to eat a potato. And if I felt that I ate too much, the next day I wouldn't eat anything at all. It was less than 300 calories. And every day I tried to go lower. And at this point in 2018, I was down to a cup of spinach and a cup of celery. That's all I was eating every day.
Yeah, but Valerie, did you realize what you're doing, in terms of diet and the repercussion it was having on your own body? Were you conscious of that? And, what do you think propelled you to do this?
I was well aware of what was happening, but when you have mental illness in terms of schizophrenia, when the voices are screaming at you that the food is going to poison you, or that someone is going to harm you, the need or the want to eat is gone. And then you pile onto that the anorexia, which is a whole separate issue in itself. When I looked in the mirror, I saw someone who was very obese, even though I knew that I wasn't. And the drive to starve, drive to over-exercise, the drive to just punish myself. And the goal was to not be here anymore. The actual goal was I felt like I deserved to die. And this was my slow way of suicide. I mean, I didn't ever plan to end my life, but the overdriving force behind anorexia is the self-hate, and cannot get away from it. It is not something that you can, traditional treatment, it's not something that you can turn off. And it's not something that you, when you're following what they say they want you to eat to prove that you're not anorexic anymore, and you put on a little bit of weight, it's always with ultra-processed carbs. And that just drives the brain inflammation higher. I didn't know it then. I know it now. I knew what I was doing. I knew that I didn't want to be sick anymore, but I had no idea how to pull myself out of this cycle. I expected doctors to advise me. I expected doctors to help me, to show me the way out of this. And that never came.
Pardon me, Valerie, I think I'm going to cry listening to your story. I'm already in tears and I have no words for what you've gone through. It's very emotional for me. But Valerie, just tell me before we jump on to, I'm so sorry, before we get on to the carnivore diet and the healing parts that you saw, how were people around you behaving with you, and how were they assessing your situation? Was nobody trying to help you out? I mean, you of course approached the doctors, but what about the family? How about the community? How were they seeing you? What were they doing for you?
I was not living in a hole. No, I was not isolated. I had advocates for me. I had family around me. As a teenager, my mom was in my corner fighting for me every single day. My grandparents were fighting for me every single day. In my 20s, my husband desperately wanted me and supported any help that I could find. If I needed to drive an hour away to see a new psychiatrist that promised that he could help me, that promised that he could find a medication that would lessen my symptoms, he was fully supportive. Go do whatever you need to do. You know, whatever we need to do to get you well. I had support. I was hospitalized 7 times in 15 years in all sorts of facilities and hospitals that were mental illness and anorexia, and some for physical surgery. And they knew from looking at me and from my health what my state of health was in. And so I was actively seeking help all of these years. Nothing ever helped.
Thank you so much for sharing that horrifying, I would say, story, Valerie, and therefore we can justify the win that you found finally. You were struggling for at the till the age of 48. By 48, I think you had lost hope. What was it that made you finally, given all those voices that were going inside you, how did you overcome that and to finally get on to a carnivore diet and, try to at least change your life, to begin with? How did that thought come?
Well, the definition of insanity is doing the same thing over and over again and expecting a different result. And at this point, I knew that this was not working and it was never going to work. Every psychiatrist that I had a relationship with always started with, okay, we're going to get you better. We're going to talk about your childhood. You're going to take this combination of 3 or 4 antipsychotic meds, and you're going to feel better and you're going to get your life back. And over the course of months that I would see them, their message would change. And at the end, they would say, you're going to have to accept that this is who you are. You have intractable mental illness, and there's nothing that we can do for you. And then I would not go back to that one. I would do things on my own a little while, get work, relapse, get worse, and then try again. So this cycle just went on over and over and over again, year after year after year. And I knew that this was never going to produce a different result. So I started looking online, and I knew it had to be something with my brain, because I'd been weight restored several times within there. And the lie that traditional treatment for anorexia tells you is that once you get your weight up, you won't be anorexic anymore. You'll be free from it. Well, yeah, you need to gain weight, of course, but gaining weight on their food plan, which is, when it's the liquid nutrition, it's canola oil, high fructose corn syrup, and soy, which is what's put in a feeding tube, what I had when I would go inpatient. And then they transition you to a tray of food and send you home with a meal plan. And it's all muffins, cakes, bagels, pancakes, always plant-based, no animal protein, no fat. And of course, I never got better. I would gain a few pounds, I would weigh more, but nothing ever changed mentally. So I quickly relapsed. Nothing had changed inside my brain. So I knew there was something wrong in my brain. And so when I started looking online about, what does our brain need to function right in terms of supplements? At that point, I was ready to take handfuls of supplements. I wasn't ready to eat food, but I wanted to find out what am I missing? Is there some way that I could be even 10% better than what I am now? And that's when I found Dr. Georgia Eid, Dr. Chris Palmer, who are both metabolic psychiatrists. And then along the way, I found Dr. Ken Berry and Dr. Sean Baker. Combining that information, that knowledge, I began to understand that the mitochondria in our body, the inflammation in our body, the metabolic brain dysfunction that happens is because we have over 100 neurotransmitters in our brain. And in order for those to produce, in order for those to function optimally, they have to have the building blocks of the amino acids that make those neurotransmitters. For instance, the neurotransmitter acetylcholine, you have to eat foods with choline in it in order for your brain to make acetylcholine. Well, what's high in choline? Meat, pork, bacon, all of the animal foods that I had not consumed for decades. And as I continued to learn and research and start to put these pieces of puzzle together, it seemed too simple. But at the same time, these were the same foods that I had not eaten since I was a teenager. And could this possibly, I'm like, there's no way that this could make a difference in how I feel. All these doctors, all these world-class doctors that I've seen are all saying it doesn't matter what you eat. A plant-based diet is the best thing for you, the best heart health, cholesterol lowering diet. And the only thing that's going to help your brain is to take these meds. Whatever you eat does not affect your brain. And I believed that. I believed that for many, many decades. And of course, I don't believe it now.
Right.
So I was armed with knowledge, but the conundrum was, because of the anorexia, how do I implement this? How do I, I wasn't trading one plate of food for another plate of food. I wasn't eating whole meals. I was forcing myself to eat this cup of spinach, which I still felt like I didn't deserve. So I had to figure out a way to do this. And so it took me longer to heal than most people. Most people have mental health benefits way sooner than what I experienced because of the anorexia. It took me 8 weeks to be able to eat 8 ounces of meat because I had to literally one bite a day. That's all I could eat was one bite. And then I promised myself that if I could do that for a week, I would double it to 2 bites. And then on the third week, I doubled it again. It took me a long time to get to a point where it was even considered a normal serving of meat. And so, when I talk to others, I tell them don't base their healing time frame. Healing does take time, but unless you're dealing with severe anorexia, where you literally cannot eat a full meal, if you are able to, you are going to heal faster. You're going to notice positive changes sooner than what I experienced. But thankfully, I didn't put myself on a time frame. It wasn't like, oh, I'm going to do this for 30 days or I'm going to do this for 90 days. I didn't have anything left to try. I didn't have left to go back to. I didn't have a life back to or a way of eating back to. This was it. I was going to do this until and when it either helped me or I perished. I didn't have anything left to try. So that's what got me started doing this.
Yeah, amazing, amazing. Before I ask Valerie, the levels at which she has healed and the conditions which she has healed, Valerie, go back to the time when you were seeing and changing doctors after doctors. How do you see the normal standard treatment that the doctors were giving you, the psychiatrist? What do you see was wrong in that? Now that you've healed, you've come a long way. Going back, what is wrong with the way, they were handling a case like yours?
Traditional psychiatry failed me. Longest time for most of my life, I always felt failure, that there was something wrong in me that wasn't doing things right, or that there had to be a flaw in me. And I now know that it wasn't me. It was the way that they were treating my illness. That's all they would do is talk therapy and dispense medications. That's all it was. And when I was inpatient, of course, that was when they would control what I was consuming, whether it be a feeding tube or of food. And that traditional protocol they have in place is that all foods fit when you have an eating disorder. You prove that you don't have an eating disorder eating pizza and cake, and that's the only way that you can get over eating disorder is by eating these highly processed modern foods that, of course, when you're anorexic, you think of them as foods. So that's why those were the ones that they would say you have to eat. If you can eat the cake and the pie and eat it without and get over your fear, then you would be well. Of course, traditional talk therapy is good. I'm not saying that it's bad. It's a necessary component. If you have lived through childhood trauma, if you have lived through any kind of physical, sexual, emotional abuse, you do need to talk through. The problem with that is I did have issues that I needed to talk through, but I was so malnutritioned that I couldn't take new information in order to process these bad memories and lay them to rest. That takes something that they call neuroplasticity, where you have the nutrition so that you can take in new information, you can process these old memories, learn to deal with them in a different way, and come out of it on the other side, and mental healthy attitude about those memories. And that component is not there. You spend hour after hour after hour rehashing your childhood memories, and it won't go anywhere. There's no resolution because you're so ill. Your brain is not functioning optimally because of your lack of nutrition, that you process even the talk therapy to get to a place of resolvement or healing. And then the whole other issue of the psych meds, on 3 or 4 at a time, and then they would pull out and put a new one in and adjust the dose and take one out and put another one in. Over the course of 30 years, I was on 15 different ones. Ones for the schizophrenia that were supposed to lower the volume of the voices. Several SSRIs, of course, for depression. Sedatives for anxiety and panic attacks. Some that were targeted specifically for obsessive compulsive disorder. None of them ever reduced my symptoms at all. All I experienced from them was bad side effects. And when I asked to go off of them, to have help tapering off, they would refuse. So that was something that I had to do on my own also. I had to figure a tapering schedule. The last 3 that I was on about a decade ago, and because I was functioning worse on them than I was off of them. I was a zombie. I was already losing touch with reality because of the schizophrenia, because I was going into these paranoid delusions. And the medication on top of that, I would just be in bed or on the couch, would just be sedated. I would just be a zombie of somebody who hears voices. It was just bad side effects and other side effects too, but the sedation was the worst.
Yeah, Valerie, let's come to the second part of your story, and which I want more and more people to hear. Once you came onto the carnivore diet, how did the changes start coming? What did you feel? How did you feel better? What were the first signs that you noticed that this is something that you want to or continue doing? Or is helping you out?
Like I said, it took me longer to notice that I was getting better. So at about 3 months in, when I was finally able to eat about 8 ounces of meat, for the first time, I felt like my anxiety and depression was lowering. And so I just kept going. I paid attention to how I felt. My family around me was starting to notice a little bit of, I wasn't quite as anxious, and I was smiling a little bit more, not quite as much tearful, because I couldn't go a day with crying. And at the 6 month mark, 6 months in, when I was eating even more, that was I knew, even if I had not gotten any better than what I experienced at 6 months, it was going to be worth it. That was the first time since I was 8 years old that the schizophrenic voices quieted. They felt like they were in another room with the door closed. They were still there, but they muffled. They were like I had earmuffs on, or they were, in another room with the door closed. I had never, ever experienced a reduction in that. And so because that was more quiet, the drive to punish myself so lessened. So the daily episodes of cutting my arms and legs, I didn't need to do that anymore. That severe component of OCD, which is also a neurological disorder, was being healed by what I was eating and by the plants that I had removed from my diet. I mean, using carnivore as an elimination to really understand what foods make me feel like, which foods heal me and which foods negatively affect me. It's an absolutely amazing way to discover for each unique person what helps and what harms. Because there's plenty of people that can eat low carb vegetables with no problem. But I did damage to myself because of them. So I had to figure that out. So more happened another 3 months in. At 9 months, my anxiety and depression were markedly lower. I was feeling joy. What used to be gray and sadness was now in full living color. I used to look at a sunrise and a sunset. I used to look at holidays and Christmas lights, New Year's. That was sadness for me. That was all dark. And it was almost like I couldn't see color. I couldn't experience color. Everything was dark and gray and sad. And now, at the 9 month mark, and then at 1 year in, 8 years ago, everything is vibrant. Everything is full of color. Everything is brand new. It's like rising from the ashes. And
yeah, like a phoenix. Valerie, you really
yes,
deserve to be called a phoenix. You
yes,
have risen from the ashes. In fact, I was going to ask you, you mentioned that, your brain healed even before you gained the weight. And, so much
yes,
of difference made just with the carnivore diet. And Valerie's narrating, how she had, started seeing improvements after improvements, down the months. So, Valerie, continue with this and, in short, probably so that we can put in more questions to you regarding the skepticism coming from doctors and everybody. So just take us through the journey of how you started seeing the colors and the life back, again.
yeah, yeah. It's just been absolutely amazing. And I bring up that point in most of my interviews about not about healing my brain, but it didn't involve weight gain yet. And the reason I bring that up is just for the anorexia component. That part about gaining weight yet is not significant for schizophrenia, for OCD, for anxiety and depression. I bring that up specifically for anorexia because that is the protocol. They say the traditional treatment is that you will be better when you are weight restored. And that is not true. And like I said before, it is critical that I gained weight. I had a BMI of 11. I was not going to last much longer. I was not going to live. But the mental illness has to be healed first. And the reason that is that there are so many components in anorexia that you will just relapse at the drop of a hat. If your brain has not healed and you're seeing on your body and in a mirror, you're feeling these feelings about feeling not worthy of eating, or certain feelings that you have about what's going to happen to your body if you eat this food, combining that with what you see when you look in the mirror, that has to be healed, because that in a sense breaks the chain, breaks the cycle of gain a little weight, relapse, gain a little weight, relapse, because the mental illness anorexia has not been healed. So I make that distinction at that 1 year mark, and everything was gone. I had not gained any weight yet. Years 2 and 3, I effortlessly gained weight. I never experienced another relapse. The body dysmorphia was gone. I could look in the mirror and see what I looked like and be able to agree with everyone else that I have to fix this. I I have to eat. I have to put weight on and get to a healthy weight and resculpt my body and redo my body composition and put on muscle. And doing it after the mental illness is healed is a way to do it effortlessly because there's no chance of relapse. The mental illness is gone. I just was able to just pull my meals and just eat more. And as the weight came on, it was something that was welcomed. It wasn't something that I was fighting against. It was what I had done for 48 years. When a few pounds had come on, I felt disgusted with myself, and I couldn't to starve and back off or go do 4 hours of cardio or go on the elliptical machine or go run in order to burn those calories off. Nothing had changed. And so that's what is amazing about this is healing and then being able to go on and heal the physical issues and not slip back into any problems.
Amazing. Valerie, what is your typical diet now, right now? I mean, what are you eating these days? Of course, you're feeling wonderful and you're looking absolutely smashing, but please let us know what are you eating these days to be looking so smashing?
I eat a lot. um, I have some guys that follow me on social media, and I eat more than that. But I have a fast metabolism, so if I eat less than what I'm eating, I lose weight, and I don't want that. I eat 2 meals a day, and I enjoy intermittent fasting. I like how I feel in a fasted state for extended period of the day. So I eat 2 large meals in a shorter kind of window in the evening, and I spend the rest of my day in a fasted state. And I have lots of energy and lots of joy. And then within 2 meals, I prioritize a lot of beef. I eat a lot of beef roast, ground beef, steak, all kinds of cuts of beef. I eat some fish. I eat eggs now. I had to heal 6 years of egg intolerance, and I can only eat eggs now. So eggs are a daily part of my diet. And I do eat some other meats in there, but I eat some chicken, some pork. I'm hungry for it, but it's not a daily occurrence. So most of what I eat is beef and eggs, and it ends up being about 3 pounds, about 1.5 pounds at each meal.
Yeah, and some people may say that your recovery is just anecdotal, but what would you say to the skeptics, the doctors, or the people around you who would say that? And how do they see you now? Can they
Yeah,
believe the transformation?
yeah. I've gone back and done that. Yeah, my family have been overjoyed to see, what has happened. The skeptics, we all know that what we eat, our diet, affects our internal organs. It's widely accepted that what you eat affects your heart, your liver, your lungs, your kidneys. Why is the brain any different? We treat the brain as if it is separate from our body, and that what we eat doesn't affect our brain. Our brain is just another organ. It is the same as when you eat sugar and it harms your liver. The same thing happens to your brain, and the same thing happens with seed oils and all of these other components that harm other internal organs. It's doing the same thing to our brain. Our brain is just another organ in our body. So it's not anecdotal. All of us, you included, who have used this diet to heal, we are anecdotes, but we are data. We are data that's being compiled into thousands and thousands of people. We're no longer anecdotes. We're the real world data that is showing what the power of nutrition can do. Going back to my doctors, that was a trip. That was they were condescending, very, very condescending. and hostile. And the ones that I went back to, finally quit going back to them because I thought that they would be curious. I thought that they would, even if they don't agree with how I did it, wouldn't you want to know that someone is much better, that's completely healed, and maybe I can look into it. Other clients, I naively thought that maybe some of them would be curious, but I got one of three messages, and it's hilarious when you hear what I'm about to say. One of them would say, "You're only experiencing a placebo effect, and you're going to have a psychotic break, and you need to get back on medication. It's just a placebo effect."
Yeah.
And then I had a couple of doctors tell me that the carnivore diet is only masking your symptoms, that you need to get back where real doctors are going to help you. Like, masking my symptoms, it's been 8 years.
Yeah, and the real diet that got you here in the first place, and you
Yeah.
had been eating that all around,
Yeah.
is
And then
absolutely
the third
amazing.
response is the regular, portion of the big pharma doctors that just say, "Oh, carnivore is unhealthy, and all that red meat and all that fat, you're going to get heart disease, and you're going to," yeah. So I would get one of those three responses from it didn't matter whether it was a primary care physician, a psychiatrist, a registered dietitian. They all had one of those messages to give me, and yeah, it was not it was not productive going back.
I'm so glad you're able to laugh about it now, Valerie. I mean, even you mentioned my story, and I had gone through this, the same way. Uh, the spirit of scientific inquiry, I think, is not there. It's absent because even though they may not use the same diet, or they may not even try it on their patients, but the curiosity to know what you did that got you here in the first place, that's absolutely absent, and which is very, very sad. So, Valerie, one last question. What is the message that you would want to give to so many people who are struggling with mental illnesses? Yours, of course, is very, very serious, and varying degree to which people are experiencing these symptoms. What is your message to them?
My message is, it's estimated that there are 1 billion people struggling with mental health issues. And of those, 20 million have schizophrenia. And anorexia holds the highest mortality rate of all psychiatric illnesses. So I look at that conglomeration of suffering. They deserve real help. They deserve real treatment. They deserve to be well. And I'm just amazed. I'm still amazed every day that I had lifelong schizophrenia and now I don't. and I could be angry, but I went through a period where I was angry at the lack of medical care, at the lack of how I could have been better decades ago if someone would have shown me, the way, shown me about nutrition, about healing this on my own. But I decided anger wasn't going to get me anywhere. I can be bitter or I can choose to be better. And I'm not going to be able to be a voice for anyone else and anyone if I'm not allowing myself to be filled with the overflowing joy that I have in order to draw people to me so that I can share with them that you can be healed physically, mentally, no matter how long you have been ill. I always tell people that there is no one that's beyond hope. There is no one too far gone. There isn't. I wasn't sick for a year or two. I was sick for 48 years. And if in 12 short months, a year, all of that is washed away and I have a brand new life, that year is nothing. That's a short amount of time to rise from the ashes. And sufferers deserve to have that message. And if it's not going to come from the top down, then each needs to reach someone.
Yeah. And Shashi and Anup are here. Valerie, to say hi to you and thank you, of course.
Hello,
Valerie,
Valerie. Yeah, hello, Valerie. If you remember, we
Hi,
were
enough.
planning a
Hi, Shashi.
podcast. Yeah, we were planning a podcast with you, but after going through your entire history, we thought better platform would be this session. And before I hand it over to Shashi, I would like to make 3 points, 3 important points. You said, psychiatry failed you, right? Now, if you look up the data for top 3 recipients of pharma bribe, there's a site called dollarfordoctors.propublica.org. Top 10, 3 are psychiatrists. That is point number 1. Then, all I can say is that pill-driven protocol is pathetically insensitive to what a patient goes through. Your case has been an anecdote defined as one. You were threatened. I mean, you scared with all, you will land back into same situation again. 14 years back, when I said I am going low carb, I was told I will die of multiple organ failure. So this system is pathetically corrupt. That is all I want to say. Thank you, and thank you for coming. Many of our, teammates were listening to your story with wet eyes.
I'm absolutely
thank
honored
you.
to be here. I'm so thankful that you asked me to come. It's just been an honor to be here.
Thank you, Valerie.
Valerie.
Thank you.
Thank you.